Back in the capital, Accra, a technical advisory group on a four-nation urban health research project have met in Accra to strategize for the next step of the research project, codenamed Community-Led Responsive and Effective Urban Health Systems. The partners in the health sector brainstormed on targeted areas and proposed interventions to ensure a successful implementation, Gifty J reports.
For some time now, researchers of the University of Ghana School of Public Health are taking part in a four-nation global research project. The Community-Led Response and Effective Urban Health Systems, CHPS, aims to undertake research that responds to the practical challenges of delivering equitable healthcare in the urban slum areas of Bangladesh, Nepal, Nigeria, and Ghana, with a focus on urban CHPS zones. In Ghana, CHPS is taking place in the Medina La Nkwantanan municipality and the Sherman municipality, using Ayawaso West and East municipalities as control assemblies. Findings of the baseline and needs assessment program revealed that patronage of CHPS zones have reached an all-time low in those areas. Residents of the Medina La Nkwantanan and the Sherman municipalities prefer to visit a pharmacy when they fall sick than report or assess the services of health officials in nearby CHPS zones. Based on these findings, researchers and partners on the project on Wednesday met in Accra to discuss the next phase of the project. They intend to implement interventions in the CHPS zones, including empowerment of community health officers, public education and awareness creation on CHPS zones, and the facilitation of activities of community health officers. Professor Basie Benso of the University of Leeds School of Medicine and a co-director of CHPS speaks about the timeliness of the project.
Currently, most of the health work that governments do focuses on rural areas. But with the problem of increased urbanization, the problems are now arising in urban areas as well.
Professor Helen Elise is a global public health expert and the research director for CHPS, and says she's impressed with the work done so far.
Within the urban context, there's a real realization across Ghana Health Service at all levels that actually the context is so different in the urban areas that we need to do something a bit different with CHPS. So today was just really helpful to hear from Ghana Health Service the different areas where we can try to intervene to improve how CHPS is going to work in the urban areas particularly to reach some of the poorest communities.
Dr. Genevieve Aiti is the principal lead director for CHPS in Ghana.
So the whole idea is to bring them together to verify our actions and then to provide us with advice.
Current studies show that about 68% of the world's population is urbanized, and by the year 2050, most of the world's population will be living in urban areas. The researchers say outcomes of the project will help inform policy towards urban health. Gifty AJ, GBC News, Accra.